Big move that could impact what you pay for health care here in California.
But a new bill is already drawing intense opposition from physicians, hospitals, and other healthcare providers. 10 News anchor Ariel Wessler is here with how you could be affected.
Yeah, Steve Lindsay, obviously a huge issue. There's a lot of anxiety when you go to the doctor about what you are going to pay. What will that bill be? The ongoing debate, of course, how do you control healthcare costs? Well, one California lawmaker is offering a solution, an across-the-board price cap set by the state. This latest effort to wrangle in skyrocketing costs comes from a lawmaker in San Jose.
Average San Diegan, the average Californian is not going to put up with the status quo anymore.
Assemblyman Ash Kalra wants to create a commission to set prices on medical services with rates similar to Medicare.
Right now, we don't have an open process at all. It's being done privately, being set by the private sector, and we all pay for it.
Or $100 copay.
SEIU is one of the labor unions backing his plan. The local leader in San Diego tells me every day many of his members must make costly decisions.
Am I going to go to the hospital and pay that huge copay or pay for those prescriptions, or do I put groceries on the table?
But opponents argue there is a major downside.
It's not the cost of care they're lowering. It's the payment for care that they're lowering. The costs still go up.
San Diego Dr. Ted Mazer is leading the charge against this measure. He says the plan will drive doctors out of the state or encourage them to retire.
In essence, saying it doesn't matter what it costs you to serve the patient. This is all you're going to get. Okay, that does not drive the cost curve down. It drives doctors out.
A quick fix, he says, could cost you more in the long run.
You're looking at a state that's already facing a shortage of physicians.
Supporters put out this chart. It shows we pay up to 20 times as much as people in other countries for the same medical treatments. And that's the problem supporters hope to solve with doctors at the table.
If they're not part of helping us come up with a solution to this unsustainable healthcare system is going to take all of us down.
Now, this isn't the first time that California has seen something like this. Back in 2014, you may remember California voters overwhelmingly struck down a ballot initiative that would have given the state insurance commissioner power to block excessive rate hikes. But either way, clearly a complex issue here. And I was looking at some numbers. The California Healthcare Foundation, they track these kinds of costs. They found from 2002 to 2016, for those of us that get insurance through work, the premiums went up more than 240%. And in that same time frame, you're looking at 40% for overall inflation. So everybody agrees that something needs to be done. Costs definitely getting out of control, but as you heard the doctor say, just because we're paying less doesn't mean it's costing them any less. In California, the most expensive state for doctors to practice in the country. So.
Wow, really
broken system.
eye-opening.
All right, thank you, Ariel.